A veteran's eligibility for community care depends on their individual healthcare needs or circumstances. There are 6 criteria that can qualify a veteran to receive community care, and a veteran only needs to meet one of these to be eligible. In consultation with their care teams, a veteran may be eligible for community care in one of the following situations. 1. Veteran needs a service not available at a VA medical facility. In this situation, a veteran needs a specific type of care or service that VA does not provide in-house at any of its medical facilities. For example, if you are a female veteran and need maternity care, you would be eligible for community care because VA does not provide maternity care in any of its medical facilities. 2. Veteran lives in a U.S. state or territory without a full-service VA medical facility. In this scenario, a veteran lives in a U.S. state or territory that does not have a full-service VA medical facility. Specifically, this applies to veterans living in U.S. states Alaska, Hawaii, New Hampshire, U.S. territories Guam, American Samoa, Northern Mariana Islands, U.S. Virgin Islands. For instance, if you are a veteran living in Guam, you would be eligible for community care because you reside in a U.S. territory without a full-service VA medical facility. 3. Veteran qualifies under the grandfathered provision related to distance eligibility for the Veterans Choice Program. For this element, there are a few different ways that a veteran could be eligible for community care. Initially, there are 2 requirements that must be met in every case. Veteran was eligible under the 40-mile criterion under the Veterans Choice Program on the day before the VA Mission Act was enacted into law, June 6, 2018. And veteran continues to reside in a location that would qualify them under that criterion. If both of these requirements have been met, a veteran may be eligible if one of the following is also true. Veteran lives in one of the 5 states with the lowest population density from the 2010 census: North Dakota, South Dakota, Montana, Alaska, and Wyoming. Or veteran lives in another state, received care between June 6, 2017 and June 6, 2018, and requires care before June 6, 2020. For example, if you are a veteran who has lived in Kansas since 2012, your home is 41 miles driving distance to the nearest VA medical facility with a full-time primary care physician, and you received VA care between June 6, 2017 and June 6, 2018, you would be eligible for community care until June 6, 2020. 4. VA cannot provide care within certain designated access standards. In this situation, a veteran meets specific access standards for average drive time or appointment wait times. For average drive time to a specific VA medical facility, the access standards are 30-minute average drive time for primary care, mental health, and non-institutional extended care services, including adult day health care. 60-minute average drive time for specialty care. For appointment wait times at a specific VA medical facility, the access standards are 20 days for primary care, mental health care, and non-institutional extended care services, unless the veteran agrees to a later date in consultation with their VA healthcare provider. 28 days for specialty care from the date of request, unless the veteran agrees to a later date in consultation with their VA healthcare provider. For instance, if you are a veteran and live 10 miles from the nearest VA care team, but it takes you over an hour to drive there on average due to heavy traffic, you would be eligible for community care. 5. It's in the veteran's best medical interest. In this situation, a veteran may be referred to a community provider when the veteran and the referring clinician agree that it is in their best medical interest to see a community provider. For example, if you're a veteran with a certain type of ovarian cancer that your VA oncologist is not experienced in treating, and you live close to a community medical facility where there is a specialist for that type of cancer, you could be eligible for community care if the clinician and patient agree that this treatment should be provided by the community medical facility. 6. A VA service line does not meet certain quality standards. In this scenario, if VA has identified a medical service line that is not meeting VA's standards for quality based on specific conditions, veterans can elect to receive care from a community provider under certain limitations. For example, if VA has identified that the cardiology service line at a local VA medical facility is not providing care that meets VA's standards for quality, you may be able to elect to receive your cardiology care in the community. However, there may be limits on when, where, and what is available under this criterion. In addition to the 6 criteria, veterans may also be eligible for urgent care from a community provider who is part of VA's network. To be eligible for urgent care, veterans must be enrolled in the VA healthcare system and have received care through VA from either a VA or community provider within the past 24 months. Finally, please note the following about eligibility for community care. Veterans must receive approval from VA prior to obtaining care from a community provider in most circumstances. Veterans must either be enrolled in VA healthcare or otherwise eligible for care. Eligibility for community care is dependent upon a veteran's individual healthcare needs or circumstances, and VA staff members generally make all eligibility determinations. To learn more about the eligibility for community care and to find out if you are eligible, please contact your local VA medical facility or visit va.gov.